Greetings. Let's take a look at the HIPOP model. We've got two tracks of ORs, each with an anesthesiologist and a surgeon, and two ORs in the base case. So I'm going to just describe what I call track A. So patients arrive, and they arrive every 90 minutes. Let me just show you the detail of this on patient arrivals. So if I go here, I probably need to expand this significantly. So you can see inter-arrival times are normal with a mean of 90 and a standard deviation of 5. This 0 and infinity just truncates the normal distribution so that we do not get negative numbers. So they're arriving every 90 minutes. We start a timer on them right after arrival so we can figure out what their flow time is. Their flow time is defined as the time from arrival to the time that their surgery ends. Now, of course, they're going to go on to recovery and discharge and whatnot, but we're going to measure it as our flow time, the time from arrival to the time that their surgery is done. This is a time of interest to their friends and family, perhaps, who are waiting for news, and so is an important measure. And I think by minimizing this, you do minimize anxiety and stress on the body. So we're going to start the timer, and then we're going to pull somebody from the registrar pool. So let's have a look at the registrar pool. This is uses the resource type registrar, and there are two people in that registrar pool. And to get registered only takes 5 minutes. So what happens here is the patients come in and they wait to get registered, and registration takes 5 minutes. Let me just see if I can expand it all the way across here. 5 minutes with a standard deviation of 2 minutes. Right, so then the registrar is released, and the patient goes on and looks to, sees an OR. So we basically now registered and waiting for an OR. And we're going to seize one OR from this so-called operating room pool A. So let's have a look at operating room pool A. There are two ORs in here. There they are. And basically, you grab one after one becomes available, and then you're going to go in there. So we're attaching that operating room to the patient as they go in. So this is a little, the notion here is a little idiosyncratic with the patient. Sort of, it's like you have to accumulate resources as you go through this business process of the surgery. You get registered, then you kind of have to find an OR, grab it, attach it to yourself, go and find an anesthesiologist pro or anesthesia pro, grab that person. Once you got that, grab a surgeon, you get to go through your surgery. So it's a little sort of counterintuitive, but the patient is proceeding here through this process and is grabbing these resources as needed. All right, so this patient then grabs one OR, then grabs an anesthesiologist. So you have to wait for each, and we're attaching that also. All right, there's an attachment. This is one of the debugging issues that I've had with this model. All right, then we're going to the patient is going to go through the prep, the consent, anesthesia consent prep, and gets sedated, and that takes place in a mean of 25 minutes with a standard deviation of 7.07. Then you grab a surgeon. The surgeon is grabbed from surgeon pool A. There is only one surgeon in there. I'll just show you that. There is the surgeon. And this surgeon then completes the surgery in 100 point, let's see, just click on that. To just scroll across here. So 100.71 minutes, 8.09. So, this distribution accounts for all of the vagaries of the surgery experience. That could be heavier BMI folks, lighter BMI folks. There could be anomalies, special cases, missing instruments. All of that is sort of folded into the 100.71 minute mean and 8.09 standard deviation distribution. Right, so now you're done with the surgery, and we release the anesthesiologist. And then we stop the timer. And I could put the timer before the release, but this essentially takes no time. So it's equivalent, I could switch these two around and there will not be an impact. The patient then goes off to, the real patient goes off to recovery and then ultimately discharge, or, gets put into the hospital. A few of them get put into the hospital, but we're going to basically keep, our virtual patient running. And this patient then goes and secures a cleaner for the OR, that is the EVS, driving from the EVS pool. And in the EVS pool, we have 2 people. And that cleaning process takes a mean, it's again normal with a mean of, let's see what it is, 15 and a standard deviation of 5. We will then release the OR and I guess we don't, any attached resources, the only one now really is I've saying OR and EVS, but the EVS would have been released actually back here. So everything's released, and then we dispose of this virtual patient that's sort of gone through the cleaning process as well. All right, so this is in essence how the model works. I want to just show you what statistics are available. So these are the resource pools here. And we will go through a number of cases using our lenses, utilization matters, variance, Hertz, psychology matters, and pooling matters to think about, changes that those lenses suggest. And then, we'll make those changes in isolation to get the performance delta relative to the base case, which we have here. And then, once you've decided on meaningful interventions, maybe you could do a composite where you explore what the mix of those would ultimately realize. So the statistics that I'm getting here are the following. I'm getting the utilization. These are going to just be final across the 570 minutes that we're going to simulate. 570 minutes, incidentally, because operations start at 7:30 a.m. wrap up at 5 p.m. That's 570 minutes, 9.5 hours in the day. And this we have to do repeatedly. So we're essentially simulating one day, and you probably want to simulate 3 to 5 days with different random number seeds, so that you observe 5 sample paths of the system and average across those results, because it's clear you could have fairly anomalous days in real life, right? You could have heavy BMI folks coming in and really not showing good performance in terms of flow times or number of surgeries executed, and then there could be the next day could be lighter folks. So with that in mind, we do need to look across a reasonable number of days to get a representative average. All right, so I'm going to get the utilization of the cleaning pool here. This is this EVS pool, and also the registrar. This is a built-in function, just to show you how it works. You point to the appropriate pool. So if you're looking at the registrar pool, you plug that in. Spelling is important, and then you just use this dot utilization function. And the particular palette item that I'm using there is you go down to the analysis, just using this statistics icon there. And you just have to feed it this dot utilization. It's a built-in for every one of the resource blocks, the resource pool blocks. Okay, and I am identifying it as a continuous time sample because we're measuring across time. Same for the EVS pool and the registrar. I'm also getting that for the anesthesia pros A and B. So notice how I've got a separate pool for the anesthesia pros in A, the surgeon in A, and the ORs in A. Okay, I haven't pulled any of these. We can possibly pool the anesthesia pros and the operating rooms, but not the surgeons, because you've got a prior consultation. The surgeon is familiar with your case history. You need to get the one that you've met prior to the surgery. So you can't just sort of waltz up to this process and get yourself a surgeon on the day and go through the process. All right, so I've got those 2 utilizations there. Also the surgeon utilizations and the operating room utilizations. Now, in addition to that, I'm showing, because we have limited space, what the time evolution of this utilization is for anesthesia pros A, the surgeon pool A, and the operating room pool A. Looks like I need to switch these around, so let me do that. For some reason it resisting. There it is. Well, messed that up. There we go. Just one A at the top. All right, and so for the OR pool room A as well. Now, we've also got the flow time, right? We've got that timer. So this timer in the A track starts at arrival and ends right here after the anesthesiologist is released. And you're going to get a distribution of the flow time for track A from that timer, and the same for track B. So those are the basic metrics here. I will run this model in the next clip, and we'll explore a slower time evolution of this model, because you do need to see how the utilizations play out and sort of what's going on in the inside, in the sort of the guts of the simulation, so to speak.